Welcome to Michigan Reimagined, presented by T.A. Forsberg and Wagoner Financial. And here's your host, Chris Buck.
Healthcare is a hotly discussed topic, and the news around this industry is endless. And you may ask, how do we balance affordability and drive true wellness in our communities? Because it isn't really happening. Here to share his unique perspective on the state of our healthcare system is the founder and CEO of Baar, Nathan Baar. Welcome back to the show, Nathan.
Yeah, morning, Chris. Good to be back.
Well, for those who haven't heard your prior shows, I encourage you to archive them and take a look. We'll get it. We'll give you a recap though. Talk a little bit about your history in healthcare and how you've sidestepped kind of traditional healthcare providing and starting your own company as Baar.
Yeah, it's funny. I was just talking to somebody yesterday about this, where they said, "Did you start your healthcare career thinking you're going to be an entrepreneur?" And they had made the assumption that they're like, "Well, yeah, you're a business owner. You must have wanted to start a business when you first started." And as I was explaining to them, as I happened upon entrepreneurship, I got into healthcare because I wanted to help people. And so I got my nursing degree, found a passion for emergency medicine, worked in the ERs on the south side of Grand Rapids. And from there, started to climb the corporate ladder. Got my master's in healthcare administration. I got to advance professionally to manager, director roles. And what that did was combine that clinical experience with the business side of healthcare, which was very eye-opening. They tell you as a clinician, like, don't worry about insurance or payments or anything else, which is right, because you don't want your clinical provider to be thinking about, can they pay me?
Right.
You want your clinical provider to say, hey, I'm going to take care of you, especially in the emergency department.
Right,
and so that's one of the basics of it. And so, we focus so much on taking care of patients, but we were blinded to the business side of healthcare. So getting into that and seeing how that dollar flowed through the system of, hey, I have an individual who's making money via a paycheck. They're paying insurance premiums. There's copays, there's deductibles. There's all these different financial mechanisms within healthcare. But we're also monetizing sickness within healthcare, and the converse benefit to an individual being healthy, but that not benefit to the health system for somebody being healthy. You try to put all these things together, and it's just like, man, this is kind of messed up. And so that's when my business mind kind of kicked in, and I started thinking about solutions that I tried to affect within the healthcare system. Even at that point, I was not thinking that I was going to be an entrepreneur or a business owner. I was just going to do my part within the system to try to create change. And I didn't realize how limiting, even though our healthcare system is so advanced, right? We have the best treatments in the United States, and that's undisputed. But you look at all the data, and you look at all the outcomes and the spend and everything else, we spend so much, yet our outcomes are worse than the rest of the world. And so you have to look at that and just say, what is going wrong? What are we spending money on? And how do we look at more of this prevention mindset and meeting people where they are versus this sickness-based reactive mindset that our current healthcare system is based on?
So reactive, right? So, I've been, I'm aging like everyone else is, and started doing more deliberate exercise, and not so much to bulk up like I might have wanted to in my 20s, but just maintain my mobility and trim down a little bit, and flexibility and strength and all that kind of stuff. And there's a poster on the wall, and it says, you can't medicate your way out of a problem you behaved yourself into.
Exactly.
And that resonated with me. And it sounds like that might be a little bit about what you're talking about, right? So we're behaving our way into unhealthiness, and we're trying to take medication essentially in healthcare to try to fix those problems, as opposed to driving better, healthy decisions. Is that kind of in a nutshell what you're talking about?
Yeah, exactly. I think what we look at is a society that loves an easy fix, and the healthcare system's been right there to develop the next treatment. You look at weight loss medications and everything else, and people have had New Year's resolutions to lose weight for forever. And the moment the easy button comes to lose weight, everybody flocks to it, regardless of cost. And this is where you have a healthcare consumer who's receiving treatment without the gatekeepers of a buying decision being made. And so all the financing of healthcare happens in the back end. But that front end consumer behavior of healthcare is driving so much of how the healthcare system is functioning. And it's based on, patient satisfaction scores. If you go to your doctor and your doctor knows you have a virus, yet they will prescribe you an antibiotic that doesn't work on a virus because it's going to make you happy as a consumer. And thus, you're receiving the care you want, but not what you need. And so there's this really weird incentive, from that payment side to the patient satisfaction side that these healthcare providers are trying to deal with internally. And it's driving these quick fixes and these medications for things that really, really require behaviors and lifestyle changes. We also look at the healthcare system and say, hey, my doctor is going to make me healthy, which is not true. Your doctor's there to treat you. And ultimately, I think in a higher functioning system, to be a coach and a guide and someone who teaches you and empowers you as an individual on how to be healthy and to live your life. But you have to own your own health. But people look at our healthcare system and they say, my doctor owns my health. Like, they're going to make me healthy, not myself.
Right.
And so there is a societal component to this where it's like, no, we have to own our health. The healthcare system is there as it currently sets to treat your sickness, not make you healthy. And so there's a narrative there that can go deep.
Right. Okay. My mind goes a bunch of different places. So I don't know if I've just become more aware of this because I'm aging or whether this is an interesting newer trend, but I've seen a lot of really unhealthy doctors and those that are out on the loading dock smoking cigarettes and eating donuts and stuff. And, is that a change? I mean, because again, if we're relying on doctors to be the people that make us healthy, you would think that they'd be modeling healthier behavior. And I just don't know, if that's a sign of the times or if that's
Yeah, you would hope and expect that. What you see is that these providers who are put on a pedestal for their knowledge and their ability to differentiate certain diseases and recommend certain treatments, not being healthy themselves. It happens a ton. It's one of my biggest pet peeves in the industry is you have someone who's there to be your resource for health, yet themselves is not living a healthy lifestyle or promoting good behaviors. They're the ones who should know how damaging it is for their own bodies to be doing this, yet they still do it. And so there's some deeper things with that related to our industry and where it's getting to from a burnout standpoint. So a lot of these providers are now overburdened because there's fewer and fewer primary care providers that are going into the system because it's not, though it's a lucrative financially for them, but from a lifestyle standpoint, this whole work-life balance side, being a healthcare provider right now is not a sexy thing. It's especially in primary care where it's the least paid physician specialty. It's not a specialty, it's just primary care. And so you're spending all of this money to go to medical school, to take care of 2,000-3,000 patients where you can only spend 7 minutes with them on average.
Right.
And you're beating your head against a wall and you're fighting a losing battle and you're getting paid the least. Or I could go and I could specialize and be a cardiologist and make $500,000 or $1 million a year, right?
Right.
But I'm treating sickness again. And it's all the money is around sickness. And there's really no incentive or money to really do primary care really well. All of those front-end mechanisms within the healthcare system are more funnel mechanisms to get into their lab services, their ORs, their inpatient units, to spend within that healthcare system. Thus, you see a lot of the system consolidation that's occurring within the hospital industry.
Right.
Yeah.
Well, I want to talk about the three-headed monster as I see it, and I really want to dive into Health Bar because again, you're not only identifying and kind of complaining about the circumstances as they are, you're also creating a solution that people can buy into and really work on the wellness side. But I want to give a nod to our friends at the Forsberg Real Estate Company. When it comes to creating the best living and working environments for the community, no one does it better than my friends at the Forsberg Real Estate Company. Brent Forsberg and his team create vibrant, holistic communities that inspire growth and encourage belonging. Focused on building stronger connections for people, a Forsberg project is always in tune with balancing relationships to create the optimal human experience. Since the 1950s, Forsberg has been enhancing the quality of lives in the communities they serve by following the principles of regenerative growth and aligning the resources and tools available. Reach out to my friends at Forsberg Real Estate Company by calling 517-349-9330 or check out their website at lansingrealestate.com. So I talked about the three-headed monster. So you have the healthcare providers, and my mind and maybe the minds of my listeners seems like they're the ones that are kind of trying the hardest, right, to satisfy customers. Then you have the insurance companies, and then you have the pharmaceutical companies, right? And I kind of look at all three of these industries, and I'm not saying that there are necessarily any bad actors, or I'm not aware of the details, and I don't want to get into brands. But you've got these three big money-making industries, healthcare providers probably being the least of them, forced to work in a system that has been created over 100 years or more. So talk to me a little bit about the relationship between the three of those as you see it, and where maybe some of the dysfunction is. Again, not necessarily trying to call out bad players, but what's the process to trying to fix this big macro, bowl of soup?
No, it's a task. It's a task. If you think back to what insurance is, right? Insurance is a tool for risk. You look at insurance, and I get home insurance or car insurance. I don't use it like a coupon. And healthcare is a very odd industry in that when we use our insurance for healthcare, we almost look at it as a coupon. I go to my doctor's office, and I'm not thinking about what that costs from a dollars and cents standpoint. What's my copay because I have this insurance or that insurance? So it's almost like a discount, right?
Right.
But if you go and you get an oil change, you're not using your auto insurance to get an oil change. You're not using your auto insurance to, buy a car wash membership or to do preventative maintenance on your car. Same for your home. But in healthcare, the insurance industry has evolved from one of having insurance, which was pooled risk amongst members, to one that's more so created these networks and these payer models that shift risk around, but also change the consumer behavior as well. And so what you find is as that insurance industry has evolved, a lot of things have evolved alongside of it, the healthcare system as well. I've always said one of the biggest things we're trying to do with Health Baar is disrupt the payer-provider relationship. So right now, as a healthcare experience, there's three involved in that. You have your patient, you have your hospital, and you have your insurance company, that payer. The individual goes and receives healthcare. Care is rendered, a bill's generated. That bill goes to the insurance company to pay. It doesn't go to you unless you pay cash for it, right? And so what happens is you have a consumer of healthcare who's blind to the payment mechanism of healthcare. But then what happens is because you're a slave to who pays you. I don't have a job. For us, I don't have a business if my customer isn't paying me, and that's what I want to make happy. So they buy more services and they talk great about me and all these different things. A hospital's customers, the insurance company, they're the ones who said, "Hey, I need to negotiate these rates. I need certain quality metrics, and these other components of the deal to negotiate reimbursement rates with the insurance company." The patient's left out of that. You have your insurance card that pushes you into a network, so you're almost irrelevant at that point in that financing decision of the healthcare experience. Now you take all of that and you say, okay, if that's the way it is, how are hospitals going to get an upper hand on that negotiation? They start consolidating. Bigger you are, the more you can negotiate.
Buying power.
Buying power, right? It's a very common. Everybody who does business understands that. And so you got these organizations who are getting larger and larger, more and more buying power. You have insurance agencies that are getting larger and larger. They're also acquiring as well. And you have your BUCAs, the major players, right? And then you have other players who are mid-market or smaller market. But everybody's trying to negotiate to their benefit. But who's getting left out? The patient, right?
Right.
And so now those are the main financial players in the system. And as the system's evolved, you're seeing those economics play out. And then over here you have pharmaceutical industry, which is just like, hey, we're here to save you. Like, you have high blood pressure. Here's the latest and greatest new medication for you. There are, and depending on what beliefs you espouse to potentially, but pharma is where I think there's majority of the bad actors. I think is where that lies. I think the insurance company and the hospital providers are really trying to do what's right. And there are bad players in those. And healthcare and insurance is a business. They're there to make money. But the pharmaceutical industry has gotten so far down these paths where they will do cost-benefit analysis when they're creating a new medication and saying, well, we know there's risk. Well, how bad is that risk? And if we're going to get sued about this much money, but if we're making billions of dollars. We're only going to get sued for a couple $100 million. Who cares, right? We just made a bunch of money. Now they'll say this is for the greater good, right?
Right.
But what happens is that now they're producing newer therapies that only produce marginal improvements in health. Now it's not making us live longer or killing diseases or things like that. It's like, hey, I'm going to get a new blood pressure medication. It's going to help a little bit more and a little bit more, but it's going to cost 10 times more. And what I look back at the healthcare industry and I say, and I want to challenge our healthcare industry by saying this, is that you don't have to prescribe those medications. Like, who's the gatekeeper for usage of those medications? You can't get that medication without a prescription for it. So physicians, providers, prescribers, like, look in the mirror and ask yourself, you think you're fighting the good fight, but are you contributing to it in a very bad way? And that's, I think, my challenge back to the healthcare system has always been, like, you're the gatekeeper. Like, you can stop this, but there's those other factors that play into that as well.
Right. No, that makes a lot of sense. And I just want to tell a listening audience, so we're talking to Nathan Baar, Baar. I forget exactly how we first met, but I'm incessantly following you on LinkedIn, and I love the thought starters. Now, I encourage my listeners to follow you and the Health Bar brand specifically. But you may not agree with everything. You may be completely on a different side of this fence, but it makes me think. The content that you provide just makes me think differently and opens up my mind to what's really going on. And it's just fascinating. So I thank you for your content and your fighting what I would consider to be a good fight. Let's downshift a little bit and talk about Health Bar. So, it's not just complaints and pointing that things are not the way they need to be. You're putting your money where your mouth is. You've started a small business called Health Bar. Talk a little bit about what Health Bar does.
Yeah, I'm a big believer in creating the change you want to see. So if you're going to do it, you better go out there and do it, or support somebody else who's doing it. And for me, I think I was uniquely positioned with my healthcare experience and that business background to be a leader in the space, or at least help with the movement that I think needs to happen. So I created Health Bar really with the idea of how do we change healthcare access from a primary preventative standpoint, but also how do we disrupt the payer model as well. And then there's this other component that we weave in. We say we have a blended medical philosophy where we take the best of Western medicine. There are great treatments and things out there that have saved millions of lives, but not going too far that way. And then blending in the good of more of this Eastern medicine, functional medicine approach, where we think the body is its best healer, and how do you optimize your own body through nutrition, through activity, hydration, mindfulness, sleep, to heal itself. We were created to have our own self-healing properties, and so we should optimize that for what we're putting into our bodies. So we take these different things and we say, we're going to go out into an industry. We're a business. We have to financially sustain. So how are we going to do that if I'm not going to bill insurance, right? It's that
right.
Breaking that payer-provider relationship. I don't want to be paid by an insurance company because then again, my motives are different. So I have to be paid by my customer. So we switch over into this cash-based healthcare ecosystem to create a consumer of healthcare. So we've gone out, we've worked with businesses and schools across the state of Michigan right now. We're just branching into the state of Illinois. We're looking at Indiana and Ohio as well. But the way our model works is we deploy nurses and nurse practitioners who do full-scale primary preventative care in those populations. So you think of an employer with 500 employees. We'll have a provider, typically a nurse, on site at that location. So those employees access our services free of charge. Their business pays for it, like a benefit essentially for them.
Okay.
So it feels like they're getting concierge medicine, but they get unlimited visits. They get as much time with their provider as they want. We blend in our medical philosophy to work with them on behavior and lifestyle changes, and all the while truly embracing this value-based care model. You'll hear value-based care a lot in healthcare. And hospitals are trying to do this. They're trying to figure out, I'm going to get paid a fixed amount to care for a person. How do I keep that person healthy and out of complex care? And there's not a lot of people who truly understand how to do that in the healthcare systems models. It just doesn't fit. Luckily, in our model, it fits perfectly. And so we're looking to advance this healthcare access model to where we're not dependent on building brick and mortar. We can deploy these clinical teams anywhere, and they're caring for more of these smaller populations. So, 500, 700 people is like its own little practice in a sense, and we have dedicated clinical hours from a care team to those individuals. So super high engagement, We see less utilization from traditional healthcare sources, so you're saving the businesses money. You're getting a happier, more productive workforce. So there's rare times where we find a win-win-win. And this feels like it. We're creating a sustainable business model. We're creating more health in our populations, and we're reducing expense at the same time. And that's kind of our triple aim at the end of the day.
Oh, and kudos. That's fantastic to hear. So just to make sure I really understand and my listeners really understand. So these employers that are signing up for Health Baar services are paying you a fee to provide service for their employees. Mm-hmm. They are probably also paying for medical benefits for their employees as well. So while this is a cash out as a value add for the employers, and believe me, everyone's looking for retention of employees. Yep. But they're also looking for healthy employees so they don't call in sick and lose productivity and all that kind of stuff. So there is a monetary reason why they would provide that. Do you find that those employers, is there any way for them to get rewarded through their premiums with their official insurance healthcare package if their employees are healthier? I don't understand how that all works, so explain it.
Yeah, typically businesses will look at different insurance models. So if you go, think of like a fully insured model is where you just pay a premium. The insurance company is bearing all the risk. What we're finding though, and you're hearing this a lot within the news, is that those risk profiles are going up and up because we have sicker and sicker populations and healthcare costs keep going up. So the insurance company is the financial mechanism. So they have to survive. So they're increasing their premiums because the populations they're caring for are getting sicker and sicker. So those fully insured plans are starting to be modified, and this is where you start seeing HSA plans, health savings accounts, FSA accounts, HRAs. There's all kinds of different things. These would be more considered level funded, where you're starting to get into a little more plan modification. There's the other side of this where you talk about self-funding, where a business says, hey, you know what? This is how, and personally, this is how I think insurance should be. The business carries a stop loss, like a catastrophic plan, essentially. They retain, or they put in a pot, a large amount of cash, essentially, and then they pay some administrative costs at the bottom. The more work they do to guard the pot of cash there, they keep. And so if they have fewer and fewer claims that are, coming out of that, just like your own HSA account, think about this the exact same way, is I have an insurance plan and I have a lot of risk, right? But if something really bad happens, I'm covered, right? But I'm going to pay some money before I get there. The more I do and the less money I have to spend out of that, I get to keep. And there's a huge financial benefit to that. So that's the same idea with what we do in employers, where our business model produces an ROI, return on investment, for these organizations. As we come in, we charge X amount, but we're producing typically 2 or 3 times the value. So we're reducing claims billed to their plan, which then keeps more money in their pockets, but they're also getting this enhanced benefit. So it's paying for itself and producing a return for them. Now, fully insured, there is value to this, but the value is on the insurance company's side. And so the better we do our job in those fully insured plan, the fewer claims that are being billed out to that insurance company. And so there's a value there.
Right.
But what happens is that if that's done consistently over the years, that can actually reduce a business's risk profile, which reduces their premium increases, which makes that fully insured plan more sustainable. And so all we're doing for us, the ecosystem is so complex when you break it all down, but all we're trying to do is the right thing. Just take good care of people, focus on health, and not make healthcare about money, make it about people.
Makes a lot of sense. Before I give another nod to a sponsor, remind us of your website.
Yeah, so our website's healthbar.com. And as you mentioned, I'm very active on LinkedIn. So we have a good LinkedIn presence for our Health Baar brand on that, as well as my personal.
Fantastic. Well, here at Michigan Reimagined, we tell stories of passionate Michiganders doing great things across the state. Today's podcast sponsor takes the art of positive storytelling to a whole new level. The good people at Good Marketing work with organizations across the state that are having a positive impact on the lives of Michigan residents. They help educate communities on the importance of affordable housing, the impact of wildlife and natural resource management, the availability of workforce development and education programs. If it lifts people up and makes communities stronger, and they want to help spread the word. I'm going to redo that, Alex. If your organization needs help communicating the good work that you do, stop by their website at goodmarketing.com. That's GUDmarketing.com. So Health Baar is providing this great service for these employers. And, I was just reminded of a LinkedIn post that you had that kind of reflected back. You paralleled a world where people are healthier and what that does to our healthcare systems. But, and you said that the pandemic gave us a little dose of what that might look like. Now, granted, they suspended, voluntary surgeries. Yep. And honestly, I think people isolating and wearing masks and doing all that kind of stuff, people didn't have the colds and the flus and all that kind of stuff happen. And so you might have the statistics, but there was a radical reduction on unsick people.
Yep.
And that was a problem as opposed to a blessing. Open that up for me a little bit.
Yeah. If you think about it, just stop and think, and you're like, this is a great thing, right? So the pandemic was not a great thing, don't get me wrong, but
right.
But reduced volumes, hospital volumes, that should be our goal. But it happened, and it freaked a lot of people out, actually. So, I was there, I was boots on the ground. Lockdowns happened. I was director of emergency services for U of M West. And the day before lockdowns, our average volumes in the ER were 180, 190. So a busy ER, right? We had 30-some beds. We were just moving. And the lockdowns happened. The next day, our volumes went from 180 a day to 60. Just like that. Full staff in the middle of a pandemic, lockdowns, like everybody's in their home thinking the world's ending. And we're in the hospital sitting there, and there's nobody. And it was the weirdest feeling ever. That kept going. It was like 60 a day, 70 a day. We closed our surgeries down, so that volume's not there. And then our reduced ER volumes and our reduced surgical volumes thus then translated into reduced inpatient volumes. So everything that we were doing took a huge dip, 75% reduction in volumes. And at first you're like, oh, okay, this is great, right? Then a few weeks into that, people really started, from more of this administrative lens, the conversations I was having was, we got to start furloughing staff. We got to start, getting people off of payrolls and doing these kinds of things because we're losing a lot of revenue.
Right.
And then you're like, whoa, like something's not right here. And I didn't even fully realize that because I was in it. Healthcare is an echo chamber. When you're in the system, like you are so like in it.
Right.
And now that I'm out of it, you can kind of look above it. So you can see the forest for the trees. And it's like, it's just so messed up. And so the LinkedIn post I had is like, shouldn't we all be striving for reduced volumes in our hospital system? Shouldn't we all be healthier? Isn't this the goal?
Right.
The goal is to be healthier, but is it really the goal? Because if it is, and that does happen, healthcare as we know it, our institutions would crumble. And so now you're like, okay, if that's the case, why are we doing this? And what are these goals?
Right. But as a business guy, I get it. Right. I mean, the long story short is that the staffing models of these healthcare providers was based on the volume of people coming through in a normal circumstance. You have a world upending circumstance that changes the amount of people coming through, and you have the rubber band almost breaking. You're like, okay, well, revenue is down, so we've got to lower our expenses. So instead of having 100 people working, we need to have 35. So what do you do with the 65? So the good news is I think that the story's probably somewhere in between. Like that was a complete shock to the system. Yep. And at the end of the day, these places need to pay their rent on the hospital or whatever, pay the salaries to the people that work there. But hopefully the reality will be through the health of health, or the work of Health Bar, and maybe just society taking more notice in the message that you're delivering. We move from 100 people working in a shift down to 75, down to 50, and we can scale this back in a way that doesn't kick the stool out from under the economics of the hospital that was built over a 100-year period.
Yeah, correct. I think, working towards that, we do have to think about a radically different healthcare future for our hospitals, though. And it's a shift from all of these resources being pushed towards sickness care and hospital systems to a switch. And you'll hear people talk about this. And right now, 90% of our healthcare spending is going towards treating and sickness care.
Right.
10% is going towards preventative. You almost need to completely switch that equation to say we need 75% of our money going towards prevention and 25% going towards treatment. And that's where you really start seeing some changes. There's you look at our government budgets right now, right? And they're trying to cut bunches of money. What are your biggest components of your government spend, Medicare, Medicaid, health-related expenditures. And you start tweaking those reimbursement models towards hospitals. A hospital gets 30 to 35% of their revenue from the government. And now you know, based on, you know, an inflation metric or whatever else, essentially are reducing, you know, or will reduce reimbursement to hospitals. Hospitals are going to figure out how to do more with less or start making some interesting decisions. But I think there's going to be a transition here that's going to be pretty uncomfortable. And so I've been somewhat trying to open people's minds up to that, is that if we really want to get to the goal, there is this period of time where it's going to feel not good as we go through it.
Yeah. Mm-hmm. Yeah. And changing it to the 75% preventative, in my brain, that kind of locks out the pharmaceutical folks who are trying to say they're sick, give them a pill. If people aren't sick, you know, I heard the metaphor back in the day, just said dead people don't pay any money and healthy people don't pay a lot of money. So the trick is to keep them alive but sick. Now, that's a very cynical mindset and I don't think that that's really the values of our healthcare providers, but I think it's devolved a little bit into the painful reality.
Yeah, no, from a pharmaceutical standpoint, I'm really interested to see, and this is something I've been watching, how will AI, everybody talks about AI right now, right? But how is AI going to provide us or get us to these points where we're able to develop formularies for things a lot faster, a lot cheaper? They're going to run it through all the scenarios. There's the human trial components and things like that. But pharmaceutical companies, they will test thousands of formularies. They'll find one that works. They'll bring it to market. They'll get a patent on it for 20 years, and they'll make a lot of money.
Right.
And we've all heard, if you look at a commercial right now, anything you see that's advertised, that's a big money maker for them.
Right.
So Super Bowl commercials coming up here, like you're going to see medications on there paying for a Super Bowl ad spot. Those ones are the ones that are the money makers.
And with the smiling people with the little puppy when they're talking about how you're going to bleed out of your ears and some side effects may be, you know, death. And it's interesting to really try to pay attention to that. Well, I got to tell you, this has been a great conversation. I do want to implore my listeners to look up healthbar.com, and that's BAR.com, even though we've been talking to Nathan Baar, Baar, and follow him on LinkedIn, Health Bar on their website and LinkedIn as well. And just really appreciate you joining me and sharing your story. Again, you know, there's a million different ways to look at healthcare, but I find yours refreshing, and I applaud the work that you're doing. And my wife and I are personally subscribing to the philosophies that you imparted and trying to live a healthier lifestyle, so I don't need any of those doctors, insurance, and pharmacy companies. So
that's right.
Thank you very much for joining me here today, Nathan.
Thanks, Chris.
All right. And I want to give a final shout out to all my loyal sponsors: Forsberg Real Estate, Wagoner Financial, Triterra Environmental, Good Marketing, Keller Williams Advantage and Team, Michigan Rise, and the attorneys at Foster Swift. All are fantastic people worth the call. And if you found the show as a one-off, I want to remind you to follow and subscribe to Michigan Reimagined on YouTube, Facebook, Apple Podcasts, Google Podcasts, Spotify, iHeartRadio, pretty much anywhere you find your podcasts. This is Chris Buck signing off for Michigan Reimagined.